Hello everybody. I hope you're all having a great Thursday today. I'm going to give it just a few minutes to let some people hop on and join us. You might see me looking down a little bit at my notes in front of me. I've had a baby and my mind is not what it used to be, so I definitely need the notes by my side here. In case anyone doesn't know, my name is Brooke Parker. I'm the founder and director of Motherly Love. I'm excited to be joining you all tonight, and I hope that this will be a help to some people out there and informative, especially for those who are suffering with this condition. So, let's see. While we're waiting for a few minutes, I'll make some announcements or reminders. So in case anyone hasn't seen our post in the last few weeks, we have resumed care packages in person to the hospital lobbies. We're really excited to be doing that again. Any expecting mamas who would like one, they are free. Just go to our website. It's motherly-love.org, and you can request a care package on the form located there. And we'll be in touch to get that to you. It doesn't matter if you're due in the next few weeks or in the next few months. Just go ahead and fill that out and we'll be in touch with you so we can get you on our books. And be sure to check out the information on there about the virtual follow-ups as well. Those are a great opportunity for moms, especially when they've just delivered. It's a phone call 2 weeks postpartum, and it allows us to do a general follow-up with the mom. See how life is adjusting with the new baby, and also do a postpartum depression screening as well. So that's very, very important. So be sure to check that out and take advantage of that. And if there's any healthcare professionals out there who would like to join us in presenting a deep dive at any time on any certain topics, just feel free to fill out the form on our website as well that we're going to be publishing, or you can message the page and we'll be glad to have you on as a guest. All right. So we've got a few people on now, so we're going to go ahead and get started since it's a little bit after 6. So tonight we are talking about polycystic ovarian syndrome. It's also known as PCOS. And I want to preface this by saying nothing in the video that I'm talking about tonight is meant to be given as medical advice or taken as medical advice. That's not what we're doing. This is just researched information that we're giving. All my data and information is obtained from Mayo Clinic. So if you have any personal questions about things you're experiencing or treatment options for yourself, or wondering if you have PCOS, then please talk to your healthcare provider about that. All right, so we're going to go ahead and get started. So what exactly is PCOS? PCOS is a hormonal disorder that is common among women of reproductive age. It affects roughly 1 in 10 women, and often it is very underdiagnosed, typically related to the fact that half of these women do not show symptoms or signs of this, especially in the early stages. And when they do, it can be very difficult because there's not one diagnostic tool to diagnose this condition. And symptoms can be often be attributed to other conditions as well. So sometimes it can take up to years for a woman to have a proper diagnosis of PCOS. And there are 3 key features that are often seen in this condition, and we're going to talk about those. The first one is something called hyperandrogenism, and this is where there are higher levels of androgens in the female's body. And androgens are the male sex hormones such as testosterone. So typically what is seen in women with PCOS is they have a higher than normal amount of these levels. Signs, we're going to talk a little bit more about this in a minute, but signs and symptoms of this can include acne, inflamed skin, excess hair or facial or body hair, hair loss, and infrequent or absent menstrual cycles. The second key feature is ovulatory dysfunction, and this is where those infrequent and absent menstrual cycles really come into play. Women with PCOS, the ovary does not receive signals from the pituitary gland in the brain to produce the hormones for these eggs to fully mature. So that's kind of what's disrupting this ovulatory process, or one of the things that is. And some researchers believe that this may be due to increased insulin levels, and we're going to talk a little bit more about that in a few minutes as well. And then the third key feature is polycystic ovaries on ultrasound. These can be seen on a pelvic ultrasound, of course. It used to be that the criteria was 12 or more follicles on an ovary, and now that has changed to 20 or more follicles. And what these follicles are just fluid-filled sacs on the ovaries where the eggs develop. These are not harmful, but they can cause hormonal imbalances and contribute to things like irregular periods, weight gain, things like that. On the ultrasound, they kind of look like tiny cyst-like formations, and they rim the ovaries, start to grow, and then stop at a small size of about 2 to 10 millimeters. And it's very characteristic on ultrasound and can be used to make a diagnosis in PCOS. As far as a root cause for PCOS, root cause is really unknown. Treatment is largely symptom-based, but it is possibly related to multiple factors working together, and we're going to go over a few of those as well, a little bit more in depth. So there are several different factors that researchers believe contribute to the cause of PCOS, one of those being insulin resistance or excess insulin. So insulin is the hormone produced by the body or by the pancreas that allows cells to use sugar. And if the cells become resistant to this insulin, then blood sugar levels can rise. Then the body might produce more and more of this insulin. Excess insulin also increases androgen production, which contributes to difficulty with ovulation. So that's kind of where that plays in with everything. The second factor that is thought to be contributing to the cause is some low-grade inflammation. This describes white blood cells' production of substances to fight infection. And research has shown that women with PCOS have a type of low-grade inflammation that stimulates those polycystic ovaries to produce androgens, further increasing that androgen level, especially if they already have this excess insulin going on as well. And this can also lead to heart and blood pressure problems as well, or blood vessel problems. Heredity is also thought to be a factor in contributing with the diagnosis of PCOS, as well as excess androgen, which we've already talked about. And this can result in something called hirsutism, which is excess hair growth, and can result in acne as well. So there are several complications that can occur because of, along with PCOS. One being infertility, which we're going to talk a little bit more about in a few minutes. That's something that's really most commonly attributed with PCOS. Another thing is something called non-alcoholic steatohepatitis. This is a severe liver inflammation that's caused by fat accumulation in the liver. Another complication is metabolic syndrome, and this is a cluster of conditions such as high blood pressure, high blood sugar, and increased triglyceride and cholesterol levels. And this can also increase the risk of cardiovascular disease. Type 2 diabetes or prediabetes is also a common complication with PCOS, as well as sleep apnea, depression, anxiety, eating disorders, abnormal uterine bleeding can occur, as well as a risk of endometrial hyperplasia, which is where the lining of the uterus becomes too thick and it can increase the risk for endometrial cancer. So these women go through a struggle physically, mentally, and emotionally. It is very debilitating, and as you can see, there are lots of different complications that can occur with this, so it's very important for them to keep an eye on their health. All right, so we've got these symptoms, we've went through all this testing, and now we officially have a PCOS diagnosis. Or how do we come about to obtain a diagnosis, in other words. So there is no single test, as I said before, to diagnose PCOS. The doctor may perform several different exams and testings to rule out other conditions. One being a physical exam, of course. They can assess your blood pressure, your BMI, your waist size, also do a skin assessment to look for any excess hair growth, acne, discoloration, or any signs of anything else that might be going on due to another condition. A pelvic exam might also be performed, as well as a pelvic ultrasound. Remember those polycystic ovaries on ultrasound, we'd be looking for that. And they can also do blood tests, and with this they can check those androgen levels to see what those are, and then also check other hormone levels as well to rule out any other conditions. So once all other conditions are ruled out, then a PCOS diagnosis may be made if the Rotterdam criteria is met, and we'll talk about that. So what the Rotterdam criteria is, those 3 key features that we talked about in the very beginning, the ovulatory dysfunction, the polycystic ovaries, and the hyperandrogenism. The Rotterdam criteria states that 2 out of 3 of those symptoms must be exhibited when all other conditions are ruled out to make a PCOS diagnosis. And that does not mean that these women will have all 3 of these necessarily. They won't have, there's really kind of a gray area with PCOS because it's not all the same for every woman. They're not exhibiting all or nothing of these symptoms. It can just be, take and give some. So once everything else is ruled out, all signs are pointing to PCOS, and then the Rotterdam criteria is met, so they have 2 out of 3 of those key features that we talked about, then most likely a diagnosis of PCOS will be made. So we've gotten a diagnosis of PCOS. What about our reproductive health? Can we still get pregnant? The answer is yes, you can still get pregnant with PCOS. PCOS causes a hormonal imbalance that interferes with the growth and release of eggs from the ovaries, also known as ovulation. But really, a lot of times there can be a misconception that women with PCOS are infertile, and that's not necessarily true. A lot of times women can have very good fertility underlying this PCOS and the symptoms and things that's messing with their bodies. So they could still have the eggs there ready to be released. They're just not releasing because of this PCOS and all that's going on in their system. So if we can get on the right track, get the treatments that these women need, then it is very possible to get pregnant with PCOS. And we're going to talk about that treatment a little bit. So treatment is largely tailored to symptoms. Also included in the decision of treatment is pre-existing conditions that the woman might have and whether or not pregnancy is desired. So if pregnancy is not desired, then there is a treatment that is kind of like the first line of defense called combined hormonal contraceptives. And this is just birth control that contains both hormones, estrogen and progestin. And this can help suppress those androgen levels that we talked about, the male sex hormone. It helps suppresses those androgen levels, and this can in turn regulate their menstrual cycles, reduce that hirsutism, which is the excess hair growth, and the acne, and it can also help decrease the risk of endometrial cancers as well. So treatment if pregnancy is desired. If pregnancy is desired, then successful ovulation is key. So there's a few things that we can do to go about this, and we kind of start with the most minimally invasive into the most invasive, and so we kind of want to work up to our treatments. So the first thing that might be recommended is weight loss or lifestyle changes, which sounds simple enough, but it's not that simple. Remember what we said before, a complication of PCOS can be eating disorder. So this woman may have an eating disorder. She may have depression that's contributing to eating disorder. There also may be other conditions going on, like thyroid disorders. So you never know what other conditions that these women might have on top of that PCOS. So this isn't necessarily a quick fix-it or a simple treatment by any means, but it is the most minimally invasive, and it's a start to where we're going. So weight loss and lifestyle changes is recommended, and this can help regulate those menstrual cycles, improve your insulin levels, and decrease even the excess hair and acne. If this doesn't work, or we can combine this treatment with something else, we can try medications to cause ovulation. If this doesn't work, then IVF treatment is also an option. And then as a last resort is ovarian surgery, but that is an absolute last resort that we kind of want to stay away from that if possible. All right, so we've gotten our diagnosis, we've gotten our treatment, we're pregnant. Now what do we need to know? So there are some risks involved with women who have PCOS and are pregnant. So women with PCOS who are pregnant have a 2 to 3 times greater risk of developing preeclampsia and gestational diabetes. And they have a greater risk of miscarriage and preterm birth. And there's a higher likelihood of cesarean delivery or baby spending time in the NICU. Now, of course, like I said, this is all risk factors. There are risk factors involved with lots of different things. And there are ways that you can help to prevent this on your part, and this is not a guarantee that any of this is going to happen. It's just they're at a greater risk. So some things that can be done to lower the risk of these problems during pregnancy: reaching healthy weight and healthy blood sugar before pregnancy is achieved. Healthy eating habits, regular physical activity, weight loss can help with this. Also, in some cases, medications such as metformin may need to be used, but these all together can help to achieve this. Also, taking folic acid is very important as well and can help with this, and that's very important in any pregnancy, so that's something you really want to be diligent about. All right, so the last thing we are going to talk about is PCOS and aging. This was a great question that I was asked a couple nights ago that this person wanted addressed in this video, so I hope this will help answer the question, but I was very interested in this as well because I didn't know before researching. And does PCOS get better or worse with aging? The answer is yes and no. So the closer to menopause a woman gets, menstrual cycles can become more regular, so that's good. But unfortunately, the hormonal imbalances that come along with PCOS do not change with age. So any symptoms that these women may have been experiencing from PCOS, unfortunately, they may persist as they age. Also, as they age, there are increased risks of PCOS-related health conditions. These can include diabetes, stroke, and heart attack. So it is very important, not only for everybody, but especially these women as well, to stay on top of their health, get regular checkups with their doctor, keep an eye on their blood pressure, on their blood sugar levels, all those things, and be an advocate for themselves and their health, because this is very important, and you want to be able to catch something in time to help potentially save your life and prolong your life and your longevity and your health. So that is all I have for you all tonight. I hope that this was informative and gave you all a lot of information maybe you didn't know. And if there's anyone that has any questions, you can feel free to leave those in the comments or message our page. I'll probably give it a couple days just to see if any questions come through and make sure that we get any and all of those. And then if there's anything that anyone wants answered, then we will certainly do an update either on a video or on a post on the page and answer those questions and make sure we get that to you. So thank you all so much for joining me tonight. I hope this was informative and this was a help to someone. I think we'll be having another one of these probably in about 2 weeks, so we'll post announcements for that as well. So thank you all so much. I really enjoyed this, and I hope you all have a great 4th of July weekend. Thank you so much. Have a great night.